Well, hello, this is Jimmy the Hammer. What follows is an interview that I had with Doctor Anthony Chaffee, and it was very gracious of him to take the time to talk to me for over an hour. I had a great time, really enjoyed it. Fair disclosure, this is the very first time of me using Zoom to do a recording, and my audio is terrible. I sincerely apologize. His is better, mine is terrible. He's the one you really want to listen to anyway. Lots of great information. And as always, I want to thank our sponsor, my dog, Titus. So that's it. And here we go with the video.
Hi, everybody. This is Jimmy the Hammer, and with me now I have Dr. Anthony Chaffee, and I really am honored to have you on my show. What such that it is for all 47 people that are watching. But thank you so much. It's been a little bit of work getting this together. Anyway, so I wanted to talk to Dr. Chaffee because he's one of the I don't know what I would, one of the foremost experts that I would say on the carnivore diet in the YouTube world. And I know the few people that follow me, they will all have questions. So first of all, what's your background? Now you are I know you're, no, don't, neurosurgeon, and you're practicing in Perth, Australia right now, right?
Yeah, so I'm a medical doctor from America, currently in Australia. I've lived in US and Europe and done humanitarian work in Bangladesh and been all over the place. Now I've ended up in Australia. I'm a neurosurgical resident, so I'm still working on that side of things, but I also have just had a deep interest in diet and nutrition and how that affects health and chronic disease and athletic performance for you know, forever, really, for athletic performance reasons for my whole life and for medical reasons for about 25 years now. And I've just seen that become a huge part of my practice and how I can better help people and treat the underlying cause of disease and not practice sick care where people just fall off the cliff in their health and you're just picking up the pieces. This is something that can address the underlying condition. You're not just treating symptoms and disasters. You can actually get people better and well, and maybe even prevent them from being sick in the first place. And so I have a practice outside of neurosurgery in what's called functional medicine, but is so better thought of as preventative medicine. So this is addressing root underlying cause, getting people healthy so they don't have these medical issues in the first place.
And I have watched a bunch of your stuff, so I know some of the stuff, which is great. But now this sounds very laudable and excellent, but this hasn't necessarily always been really smooth sailing. You've had some like serious pushback when you've just said, "Hey, this hasn't been working for you. So here's a couple of studies. Why don't you check out just eating meat?" And you've had some like serious things happen that are sad. I mean, they're just like, really?
Which ones? Which ones are you referring? I mean,
The one,
there's a lot of people online that say a lot of things, but you can't.
I'm talking about the one where you told a patient, why don't you check this out? And people
Mhm.
were listening and went and complained to your boss.
Oh, right, yeah. So that was the time when I was doing a rotation in the hospital, and I was actually on a general surgery rotation, so not on neurosurgery. And I got asked to see a consult with a lady from the gastroenterology department, and she had Crohn's disease, and it was very bad. And as Crohn's disease is. And so we got to talking, and I told her that I was from the surgical department, and I asked to consult and see if surgery was a good option for her, and discuss that with her. And she almost immediately says, "I don't want to do surgery. Is there anything I can do besides surgery? I really don't want to have surgery." So, being a responsible clinician, I'm not going to just stuff it down her throat going, no, this is the only thing. And I said, okay, well, look, what other sorts of treatments are you having? Went through that. She was on all the medications and all these sorts of things, and it wasn't working. She's still having flare-ups. And I said, well, listen, this isn't, medical. I'm not telling you what to do. However, there is information and there are studies that actually show that dietary interventions can help in these situations. Specifically, there were a couple of studies, one with what's called an elemental diet being just the elements of your diet, right? So just the nutrients. And it's highly processed. It's sort of like a powdered drink form. And they do this for epilepsy patients as well. And that's without carbohydrates. So it's just the essential nutrients and nothing else, not even carbs. So just proteins, fats, and all the micronutrients that you need. And carbohydrates are not an essential macronutrient. And so in those studies with Crohn's disease specifically, they found this was an interventional trial. So you can actually, get causation. It's not just association. They found that when putting someone on an elemental diet, that this was a better treatment for an acute flare-up of Crohn's than prednisone, right? So that the steroids is really strong steroids that just smash your immune system down and will get you out of an acute flare-up. So just not eating certain things was better than steroids, the gold standard in medical treatment. And these steroids have a lot of side effects. A lot of medications the prednisone is pretty cheap, but it's a lot of side effects. The newer medications that they have for Crohn's are very expensive and have a lot of side effects as well. So I just pointed that out. There's another study, again, an interventional trial with people with Crohn's that they put them on, they just basically excluded carbohydrates and fiber. Not much less left besides fatty meat when you take out carbs and fiber, right? Because even lettuce has fiber, right? It may not have carbs, but it has fiber. So they took out carbs and fiber, and that gets rid of processed food as well, doesn't it? Because that's going to be carbs. It's generally carbs in processed plant foods, because processed food really is processed plant foods is what we're talking about here. And so that was found to keep people, and I wanted to see if this intervention could keep people in remission without medication and how long they could do that for. And so they found that they could keep people in remission up to 51 months. So that's over 4 years just by eliminating carbohydrates and fiber, right? Contrast that with the group that did not remove carbohydrates and fiber, and they stayed in remission on average 0 months, right? So not a lot of months, especially compared to the 4+ years. So just removing the carbohydrates and fiber was enough to keep them in remission for over 4 years. So what does that mean? That means there's something in the carbohydrates or the fiber or something that comes along with the carbohydrates and fiber that cause Crohn's disease, right? And that's what we need to think about, what's underlying causing this. Because you just remove something and the problem goes away. Well, there's a good chance that that's the cause of that problem, right? And so I pointed that out. I pointed out other things, such as that we've been treating Crohn's disease since the 1800s with a pure red meat and water diet from Dr. J.H. Salisbury. It's what the Salisbury steak was named after. And the Salisbury steak was specifically made to grind meat down in such a way that you could filter out the gristle so that you absorb 100% of that meat. And so you completely rested the bowel. So if you're very sick with ulcerative colitis or Crohn's, and you're in a lot of pain and you're really unwell, you really need to just completely rest that and just let that heal. And so if you did that and you sort of filtered out the gristle, the connective sort of tough fibrous tissue, that allowed your body to absorb essentially 100% of this and rest your bowel completely. You're getting perfect nutrition, and your bowel and your colon's not getting damaged, and the rest of your bowel's pretty relaxed as well. So. And the list goes on. I mean, there's a book written by a gastroenterologist in 1975, Dr. I think it's Walter Vogelin, who wrote a book called The Stone Age Diet, where he basically argued that, hey, look, if you don't eat plants, that humans are carnivores, that's what we've always eaten. Here's the evidence. And if you don't eat plants, my profession doesn't need to exist. That's sort of the gist I got from it. And so this is all over the literature, and there's more as well. I found several studies on this in the current literature and in the recent literature. So you don't have to go back to 1975, let alone 1875. Right now, in the current literature, we're seeing these studies. And so I just pointed that out, and I just said, hey, listen, you get to do whatever you want to do. Here's some more information. Here's the names of some studies. Here are some links. Take a look at those, see what you think. Surgery is always on the table. That's always available. We're not going to run out of scalpels anytime soon. So, whatever you want to do. So, some little weasel on the gastroenterology team at the hospital sort of was just eavesdropping. Decided not to talk to me about it, not to come up to me and say, hey, what was all that about? I hadn't heard that before. Just went told teacher and told his boss. And instead of, again, talking to me and going like, why are you talking about this? Where's this coming from? Just went straight to my head of department and said, what's this guy doing? We're going to inform the medical board and try to get this guy's license dinged. It's like, and the people on my department, knew me and knew that I actually knew what I was talking about. And they were like, whoa, hold on a second. Like, why do we have to go there? Why don't we just talk to him and just see what's going on and see if there's maybe a reason that he said these sorts of things. And, if you don't like people talking about that sort of thing, you don't want that recommendation, we can just say, hey, please don't bring that up to our patients.
Yep.
And so that's what they did to me. They called me and they were like, well, there's no evidence to show that this works. I'm like, well, actually there is. And I sent them all these studies and they're like, well, actually that's a lot of evidence. So they were just saying like, look, this is something that people don't really know about and they're going to balk at it. So just, try not to give those recommendations and things like that. It's like, that's fine. It's your business. But it's just sort of funny when, especially in a professional setting, when people don't actually come to you and say, what's going on. That before. When I saw new research and I talked to patients about that new research and someone else came in, but said, hey, look, I didn't want to say something when you're talking to a patient, but like that's not true. That's not a thing. And I'm like, the evidence is pretty convincing. There's this evidence and this evidence and this publication by these research and these, groups. And that person, that was a fruitful conversation because he even said like, oh, well, you know what, look, I'm always willing to learn something too. Maybe there's something new that I don't know about. Okay, yeah, I'll take a look at that. And so that's what you're supposed to do in a professional setting, especially in medicine. These sorts of things are not set in stone. We change the opinions and views and guidelines, recommendations all the time. And new information becomes available, opinions change, and that changes people's recommendations and certain things come into vogue and out of vogue, depending on what's going on. So you always have to keep it in mind.
And unless you're the government, and then you don't change your recommendations for decades.
Definitely not. Yeah.
And so this conversation is going to be, if anybody knows me, I am a little like, I can be a little like all over the place.